booster dose or an additional dose. We still need a lot of help from the community to get our younger children vaccinated. For now, we have our 5 to 11-year-olds who are now, 32% of them who are now fully vaccinated. We encourage parents to talk to their pediatricians and healthcare providers to consider vaccinations or considering getting your child fully vaccinated and even boosted if they're eligible. As we know that while they may be at low risk, in schools, we know that many children are no longer wearing their mask and they're still in high-risk activities. Our 12 to 17-year-olds, now 66.7% are now fully vaccinated, and for our older population, above 65, 92.6% are now fully vaccinated. And again, as you see more of the data coming out, it's still much of the data still proves that vaccination is the best way to protect yourself and your loved ones from the severe effects of COVID. And tomorrow, there's an important change for COVID vaccinations here in Orange County as HRSA is changing their reimbursements of vaccinations. The U.S. Department of Health Resources and Service Administration, or HRSA, has issued a cutoff date of actually today, midnight, that they will no longer accept claims for those without insurance to cover COVID-19 vaccines. The OC Healthcare Agency will continue to offer COVID-19 vaccines as well as testing kits at our mobile pod clinics for anyone without insurance. So those in our community who are uninsured, regardless of their immigration status, can still continue to receive tests as well as vaccinations at our sites or at our community partner clinic locations. A list of those locations can be found on our website at ochealthinfo.com/COVID. Also, if you've seen in the news, there's been a new announcement about a second booster for the immunocompromised as well as those who are a certain age. On March 30th, the CDC and issued updates recommending the second dose of either Moderna, otherwise now known as Spikevax, and Pfizer, also known as Comirnaty, COVID-19 vaccine for certain individuals. The CDC's updated guidance expands eligibility for a second booster dose of Moderna or Pfizer vaccine to be administered at least 4 months after the first booster dose for the following individuals: those age 50 and older, no matter your risk, people aged 12 to 49 who are moderately or severely immunocompromised, and people aged 18 to 49 who received the Johnson & Johnson vaccine for their primary series or their booster dose. The second booster dose is available throughout Orange County, including at the OCHCA's mobile COVID-19 clinics. HCA's mobile clinics are located in places to serve our most vulnerable communities, and appointments can be made through othina.com. We recommend the general public who are eligible for the second booster to visit myturn.ca.gov to find a convenient location to schedule your booster appointment. As far as CDC quarantine and isolation guidance, even though we are seeing declines in case counts, we do want everyone to stay vigilant in helping prevent the spread of COVID-19. If you're experiencing symptoms, please test and isolate to minimize exposure to others. Also, consider consulting with your healthcare provider, as you might be eligible for a COVID treatment. There are now a lot of COVID therapeutics, which include oral antivirals, so you can just take a pill so you can really minimize your risk for severe illness. If you have been exposed, we know the isolation and quarantine protocols can be very confusing. The CDC has created a quarantine and isolation calculator to help individuals determine the appropriate prevention steps that should be taken and how long to isolate or quarantine. It's very simple to use, and we have made it available on our COVID website at ochealthinfo.com/COVID. You can also find the calculator on CDC's website. Finally, I want to take this opportunity to invite everyone to join us tonight for our HCA's bi-weekly talk show, Your Health Matters OC. Join us on Facebook, channels at facebook.com/OCHealthInfo tonight at 6 p.m. We'll be talking a little bit more about COVID, but we'll also be celebrating Public Health Week. There have been so many in our community have really devoted their time, energy, and efforts to really making sure that OC remains a very healthy community. We'll also have our environmental team come out to tell us everything they've been doing for us in our community, and that includes keeping our restaurants safe and our ocean quality safe. And there's so many other things that we're going to learn from our environmental health team. So really inviting all of you to join us at OC, at Your Health Matters OC. Thank you, Chairman Chaffee. I'll turn it back to you.
Thank you so much, Dr. CK, for that COVID-19 update. Appreciate the great work you're doing and your healthcare staff. This time we'll open up the press conference for questions to the media, starting with any media who may be present.
Thank you, Chairman. If there are any members of the media that are currently in the room present at this time that like to ask a question, I have a microphone here.
No questions inside the room. Operator, AT&T operator, are you there? AT&T operator, can you go ahead and make an announcement to the folks on the phone at the present time?
And ladies and gentlemen, if you wish to ask a question, please press 1 and 0 at this time. And we do have someone queued up. We'll go to the line of Ron Lin with LA Times. Please go ahead.
Hi, everyone. Thanks so much for taking our questions. We really appreciate it. Our questions today are for Dr. Chinsio-Kwong on the case rate trends, school outbreaks, and the new subvariant XE. So first, while you've noted Orange County has seen a decline in cases, we've noticed an uptick in cases in LA County and in San Francisco, with BA2 flattening nationwide and increasingly becoming prevalent in the nation. And we're seeing an uptick in cases like in New York City. What are the range of things you're expecting in the coming weeks? Are you expecting an increase in cases? And what about hospitalizations? Second, on school outbreaks, LA County today mentioned they've seen an increase in the number of school outbreaks. It was 10 for the most recent week, the highest such number since February. Is Orange County seeing an increase in school outbreaks? And for Orange County parents and teachers who might be concerned about what LA is seeing, what would you advise schools and parents to do? And finally, there's been attention coming out of Europe about a new Omicron subvariant called XE, which may be even more contagious than BA2. Have you seen XE in Orange County, and are you concerned about it? Thank you very much.
Thank you for your questions. Dr. CK.
Thank you so much for your questions. All pertinent. I know there's a lot in the news about all these different recombinants. So first off, BA.2 is now more dominant here in California, and you did mention that you saw or heard that LA was seeing a rise in cases. They are neighbors to us, so if they start seeing cases rise, there might be a possibility that we will see cases rise as well, but that all depends on how safe our community acts in their daily lives. You know, the more we do know that the more people get vaccinated and boosted and stay up to date with their vaccines, that is the primary goal everybody should have in mind to keep themselves out of the hospital. But second, most important, is also to continue to consider wearing your mask. So I have my mask with me here, and I still do use it in many situations because it's another protective barrier to help prevent me from getting sick. And it goes two ways. I can prevent myself from getting sick, and if I happen to have illness, I can prevent others from getting sick from me. So I think it's really important to continue to have your mask readily available and use a really high, ventilated or fitted mask. When you're in indoor settings, improve the ventilation, stay near an open window, or if you're in a business setting or a school setting, many of the schools have actually outfitted their ventilation system to make sure there's some protective barriers to reduce transmission as well. As far as outbreaks in schools, I have not heard yet here in Orange County of any increase in outbreaks in schools, although we do know that many schools have had spring break and many people have been traveling. So there is a potential that there might be some outbreaks. Typically, when we hear about it, it's typically late because we hear about after there's already been a pattern. So again, more reason for everyone to still continue to consider wearing their mask and use all the preventive measures we've been talking about all this time. As far as the recombinant XE, we have not yet isolated or sequenced XE here in Southern California or in Orange County. Although I hear about it on the news, and there's going to be a good likelihood of recombinants that's going on throughout the nation as well as globally. And this is yet another reason we all need to be very vigilant. We do not know, we have all been humbled by COVID through the last 2 years. It's been unpredictable, and some say it has been predictable, but I think, again, COVID can continue to change. It can either be more transmissible, as in what you said, XE. So for the recombination of XE, it's a combination of, so there's multiple actually recombinants, XA, XE, XD, XF, and pretty much these are recombinations of either delta BA1 or BA.2. And so depending on that recombination, it can decide to escape our immune defenses, even if we're vaccinated, or it can be more transmissible. In the case of XE, what we're hearing from UK is that it is 10% more transmissible than BA.2, which is already 40% more transmissible than previous variants. So as you're seeing, we're starting to get more stealthier and variants that are going to try to really get us infected. And again, the best thing we can do is continue to keep our guard up and be vigilant. I hope that helps answer all three questions. I'll turn it back over.
Thank you again, Dr. CK. Do we have another question, please?
We have no one else in queue at this time.
Well, in that event, we're going to conclude the press conference. The purpose, again, of the OC press conference is to show people what we have in the county, the great things we have that they can enjoy, and how they might access it. And today, you met the staff at the Orange County Animal Care Shelter and the great work they're doing, and I'd like to publicly thank them. It's something that I've especially enjoyed whenever I come out here. It's just wonderful the way they give you the red carpet treatment and help you if you want to adopt an animal. It's just great. So thank you, staff, and thank everyone for tuning in. This is the end of this conference. Thank you.